There's obviously a cost to developing drugs. There's no question. What is unusual in this situation is, if you think about it, the way it typically works is somebody decides that they have an idea to develop a new drug. They may raise money for research and development. People invest in that process, and if the drug works, the investors get paid. What he's essentially done here is taken a drug, an existing drug that is being used, and as Christine just pointed out, it's being used by doctors who think it's a pretty good drug. They're not clamoring away saying we need a new drug. So it's being used, and he's now pushing the price up to basically put all that cost increase on the consumer. He says he's going to put that money into research and development himself. Who knows? But clearly, it's the consumer who's paying now. He's taking no risk. There's no venture money folks that are taking risk on this. It's a just different way of doing drug development that really puts the patients, in the greatest sort of liability here.
So Hillary Clinton tweets out that, he shouldn't be able to do this. He shouldn't be able to raise the price 5,000 times what it was, because people need these life-saving drugs. So does she have a plan? Is that what she's outlining?
She has a plan that's coming out this afternoon. And among those plans, and Sanjay, I'd love his thoughts on this. She says that, look, the United States government through Medicare is one of the biggest consumers of prescription drugs. And why can't the U.S. government have more power in negotiating down drug prices? Because as you know, Sanjay, especially when you talk to seniors, their biggest concerns are rising costs, out-of-pocket costs for their prescription medication.
Sanjay?
Yeah, this is really interesting, and obviously there's a story here around the whole Affordable Care Act. But as part of getting the Affordable Care Act passed, one of the things that was agreed upon was that Medicare, again, as Christine points out, one of the largest purchasers of prescription drugs, Medicare could not negotiate lower drug prices with pharmaceutical companies. People are going to hear that and say, run that by me again? It's true. Medicare cannot negotiate for lower drug prices from pharmaceutical companies. That was part of the agreement at negotiations with the Affordable Care Act. And again, as Christine just pointed out, that's exactly what Hillary Clinton is talking about, saying Medicare should be able to negotiate those drug prices. Look, the pharmaceutical industry is not going to like that. They lobbied hard against that. That's going to be a fight.